Hi everyone. I'm just going to preface this conversation today with a warning. The episode contains discussions of sexual violence and disturbing content that might be upsetting or triggering for some listeners. Please use your discretion when deciding whether to continue listening. If you or someone you know has been affected by sexual violence, resources and support are available through organisations like the New South Wales Rape Crisis Centre, that's 1800 424 017, and Lifeline 131114. Additional resources can be found through 1800 RESPECT, which is 1800 737 732, and we will include all of those numbers in our show notes. But we are going to have this important conversation because non-fatal sexual strangulation has increased by 1,000% over the last 10 years. And recent research has shown that 60% of people aged between 18 and 35 have experienced strangulation during sex. 60%. That's up to 79% for people who are transgender or gender diverse. Shocking figures, Tracy.
It is. It's quite alarming, and it's quite scary, because do people that are participating, especially in sexual choking, understand or what are they consenting to in regards to their future health? Because a lot of times we're not seeing symptoms at the time, but we're talking about moving forward and what does our future health look like and what is our understanding.
Which is why this is just confronting but a really important conversation to have. I'm Nicky Sloan. I'm CEO of Community Industry Group, and I'm coming to you today from the beautiful lands of the Dharawal people. Welcome to Community Matters, the podcast where we explore community solutions with people who are making a difference. And today I'm joined by my friend Tracy Lumb, who I've known for many years. Who is the manager of the Shoalhaven Women's Health Centre. And we're going to be discussing the It Left No Marks project.
Correct.
Tracy has been, I think it's fair to say, instrumental in raising awareness and understanding of the impacts of non-fatal strangulation and sexual choking. Welcome, Tracy.
Thank you. And I do appreciate your time in inviting us here to really talk about this important subject. And while you're very generous in regards to us in the Shoalhaven and what we're doing at Shoalhaven Women's Health Centre, I would like to acknowledge Jackie McMillan and Courtney Artridge from Women's Health New South Wales, who have developed this project, grown this project, provided us with the information and the training, and given us the tools to be able to move out into our wonderful big community and really raise the awareness around non-fatal strangulation and sexual choking.
I think, first of all, maybe we should be talking to the listeners. I think there's a little bit of assumed knowledge between us about what this is.
Correct.
And I think in the interest of information, would you mind explaining what non-fatal strangulation and sexual choking is?
Okay, so non-fatal strangulation, we talk in the context of terrifying situations of family and domestic violence. And that may be, and I will say a woman. We all know, though, that domestic violence crosses genders, but in the work that I do, I work predominantly with women. Now, non-fatal strangulation can be when you are in a domestic violence situation, and we want to move away from the term strangled. Because a lot of times when we say, I was strangled, you have the image in your mind that I'm strangled. I'm not here anymore. I'm dead. A lot of times when people are strangled, they are no longer with us. But when we talk about, so if somebody said to you, were you strangled? No, No, I'm here. I wasn't strangled. But what we have to do is change the language around that. And we might say, did somebody apply pressure to your neck? Did someone sit on your chest? Did someone put their arm up against you? Did you have difficulty breathing? So a lot of times it's about raising awareness on how we as workers in community and those that we speak to and share our time with, if somebody discloses to you what happened. So what we did see is when we look statistically, and we do have to look at that sometimes, when we look statistically, that if you asked somebody that was impacted by domestic and family violence, were they strangled? They'd say no. When we said to them, did somebody apply pressure to your neck? We went to like 9 out of 10. Whole different thing. And that's, of course, something that it's been applied to your neck. What happens? The oxygen to your brain, blood circulation, all of that ceases for a period of time. Can be a few seconds. It can be extended. But those few seconds count. And this is one of the issues that we need to change the dialogue. So we're actually speaking to victims and finding out more information. That, of course, attracts a different charge if it goes to court. We're seeing a lot more around choking as an additional charge in the court circuit, and that is a really good thing. But we need to learn to change our language. So we are really assessing clients and finding their needs very early. So if we're missing that step, or we're missing that language, or we're missing that dialogue, we're missing what could be a non-fatal strangulation and a brain injury.
So that's really important for workers. Also a really important message for first responders.
Correct.
That they need to be asking that question in that way.
Yes. So when you look at, say, for example, police doing, looking at, and I hate to say, they tick, but they have to have conversations in regards to what has happened in that incident. If we can get some of that dialogue into there, it's just a whole different thing. And the outcome is going to be so much better for the victim. So much better. So that's the non-fatal strangulation side of it. We also look at the sexual choking side of it, which are two entirely different things. And sexual choking is something that has equally become a very popular. It's mainstream now. I suppose that's the only way to describe mainstream. And a lot of that's from popular culture. And, of course, a lot of sexual education for young people, unfortunately, comes from porn. And porn doesn't really depict what's going on in the world. And what we also don't want to happen is, in regards to sexual choking, I might be consenting to that practice. Do I understand it? And do I understand what I am consenting to for my future health? Because this might not come back to haunt me, bite me, for a while down the track. So it's around where young people are being educated, and you and I both know that porn's a huge thing.
Absolutely, and Community Industry Group have done various submissions on the impact of harmful pornography over many years. I think I would like to just go down that rabbit hole of porn for a few minutes, because we do know now it's so accessible. It's common, for people to access pornography, and it's changed so much very quickly the way people access it. It used to be magazines under counters, and now it's on your phone. It's on your laptop. It's anywhere you want to look for it. So we've broadened the opportunity for people to see porn, and we've really broadened the range of porn that's available. But we don't talk about it, Bronwyn.
No, we don't. And I think that's been time immemorial, talking about sex or porn. I don't know, we just leave it somewhere in a bottom drawer. But when we do look at the fact that statistics are showing that children as young as 11 are seeing pornography in their home, that is challenging in itself. And it's pretend. It's not real. They're actors. They're actors getting paid to do something. It is not a documentary. That's the only way that I can say it. It's not education. It's not a documentary. It is entertainment. And for those that choose to watch porn, fine. I'm not here to porn shame anybody. That's your life and you can do what you like with it. But there is a responsibility of those in your home that are young are being exposed to it, and you're just going, as a parent, as a caregiver, I don't want to talk about that. We'll just leave it. And that's something that we cannot do. And with the rise of sexual choking, that is something that we need to discuss, because you're seeing damage done very, very early on, and really you only have to have a couple of episodes of this in your lifetime. We're not talking in the next 10 years, we're talking in your lifetime for the damage to be done. And if children are becoming educated that way by what they're seeing, there was even a TikTok phenomenon a little while ago that young people on TikTok were choking each other, and who fell down first or didn't. You just go, oh, yay, TikTok. Unbelievable. Just really unbelievable. And it's really quite disturbing. And a scenario that I always look at is, myself as an older person, I have gone through teaching children to drive in life, and there is no way in the world that I just throw the keys at them, say, you work it out as we go along. You tell me read the rules? No. What's the stop sign? So, I don't know. What's the stop? Just drive through it. So if you're doing that to your young person, would you do that around driving? No, not at all. You'd say, this is the keys, this is the brake, this is the way that you do this, this is the indicator. Read the rules, work it out. Because going through that stop sign, there's injury or death involved in that. So why are we so, I don't know, just really confined around sex education? And
it's true. We are prudish around it, and it is awkward and uncomfortable to talk about, but it is really necessary. And the driving analogy is a great one, I think, when we're talking about porn, because, nobody watches Fast and the Furious and thinks that's how you drive.
No.
So why are we not explaining to our young people that porn is not necessarily the normal way that people have sex, that it is actors just the same as Fast and the Furious are actors?
And that is exactly right. And the what we need to do is normalise the discussion around sex education. People are always really quite frightened of, how much do you tell your child? But a child really monitors them, in a funny way, monitors themselves. At a young age, a child can say to you, where does a baby come from? And a mother will go, in there. And they go, okay. And off they go. And they mightn't ask you anything for another 2 years, so you can have a little bit more of a discussion. But it just needs to be normalised. We cannot leave it up to our teachers in schools. They've got enough going on, seriously enough going on. And we just can't leave it up to that. And you just can't leave it up to a small book. But unfortunately, we use social media and media as such a way of getting all our information now. And I'd hate to use that term, fake news. But you know what? It's not all true, and it's not all how it is. And, Snow White and the Seven Dwarfs wasn't true. It's a story, and I think we've really got to look at it that way, because we're talking about big dangers.
Yeah.
Big dangers.
Really big dangers when we're talking about 60%. 60% of 18 to 35-year-olds have experienced choking during sex. Can you explain why that is such a dangerous thing?
The danger is that the fact that what you may be looking at now that you're consenting to or not consenting to, for people that are starting to engage in sex, it is that windy road. Nobody has a manual, so to speak. Nobody knows what's going on. And if somebody says, oh, no, this is what everybody's doing and it won't hurt you, you're in a vulnerable situation. People do have an issue with saying no. We know that around consent. We know that around coercive behaviour. That has been something that we understand. But if people don't know what the impacts are, you can walk blindly into something, can't you? But some of the impacts are, and we talk about, especially for women, we often talk about brain fog. And brain fog with menopause. Yep, we've all kind of, I'll speak for myself, that type of thing. Baby brain, fatigue, exhaustion, all those types of things. And we have spoken to women when we do assessments with them in regards to what are the symptoms of non-fatal strangulation or sexual choking, and all of a sudden they go, oh, so that brain fog isn't the leftover baby brain. This could be an impact of what I've been participating in or what has happened to me. So we really have to look at, some of the information. Now, I've got to say, and I'll do this with lovely information that we've got to hear, but it left no marks is really important about when we talk about this, because a lot of times it doesn't leave any marks. There's not any visual marks on the neck, or they take a few days to come up. But there could be some of the little, marks on the face or bloodshot eyes or different symptoms. And what we have to do is learn about them. So Jackie and Courtney have put this amazing It Left No Marks website together. And there is, a tab for community, there's a tab for health professionals, there's a tab for there is so much information there. There is YouTube things, videos, podcasts, all that stuff that you can learn about symptoms and the impacts. I'm not about to go through all of them, and I don't know enough of them. They're really the experts. But in doing this, what we have done is put together, this is a local one, the It Left No Marks brochure for Shoalhaven Women's Health Centre, and basically it talks about what the risks are and what is the risk in regards to sexual choking? Who do you go to see? What are some of the symptoms? What do you do if I'm managing this at home? So there is information out there. You just really need to go and explore, have a look, Google, all those types of things. But just raise awareness. Parents, caregivers, have a look for your kids. There's also the sexual choking one, which is really an important thing, but it's around, there's lots of things. Encourage help seeking, and I love this. It has the audience. So who you would aim and target it at. I think it's just a really important piece of work, and it talks about evidence base, and that's what we need to talk about in all these types of things. So there is information available for you in community, but the website's great. Jump on, have a look.
We will definitely make sure that that there's links to the website and to any resources in the show notes today.
Yeah. And one of the things that I did want to mention also is the UK government last month has banned sexual choking. They've criminalised sexual choking in porn. So you've got a government moving forward and going, okay, we know it's out there, we know people are going to watch it, and that's fine. But there has to be some form of regulation around that. And this is a really fantastic first step, because also what it continues to promote is violence against women and girls. And again, that normalises this behaviour, and it's not normal and it shouldn't be accepted. So great on the UK government. I hope that we are not too far behind, and that would be a really good thing for a campaign. We need a campaign, but with a campaign always comes money and and workers that can provide that.
Absolutely. Well, Community Industry Group, we are constantly lobbying and advocating. So Minister for Women, watch out. We'll be coming to you because we definitely need to address this. 60%. It's slightly higher for young women, and as I said, it's really significant for the trans and gender diverse communities.
It is
really significant. So we will be coming to see you, Minister for Women, about this one.
Yes, we will. Lovely. Yes.
I think one of the great things that we're doing locally is partnering together.
Yes, we are.
To run some training around this. I'm really excited about this. Can you tell us about who that training's aimed for and what people will learn during that training?
Okay, so we have been very fortunate in our organisation that my Pathways Project site coordinator, big name, but Leanne Harrison, she is one of my workers, and one of the biggest issues around that, which we will be talking to ministers about, is these positions are kind of added on at the moment. You know, why are you doing all that other work? Can you just do this bit as well? But Leanne she comes from a medical background, and she has got fantastic knowledge, and especially in assessing the women that present to us. But what we are doing is providing training in the community. So to raise awareness, to know what to look for, to know what the information is. So we've got 4 sessions at your service, which is fantastic. And I think 3 are nearly full. And we've got one that there's still spots available for that. But what it is, some of the people that we have provided the training to already in community would be, the DV services. Yep, that's sort of given. Men's behavioural program.
Right.
They have come along and they have really got a lot out of the training because they're working with men. They can go and speak to the source if that is happening, and we know about men's behavioural change, and it's really just great that they're there learning and wanting to know more about it. The social workers at the hospital, we've done Shoalhaven Hospital social workers down there. We're doing some in Wollongong and Shell Harbour, and the more it's growing. They're reaching out to us, which is a really good thing. We're not having to do too much knocking on doors. But I think the really interesting thing, the feedback around the training has been really positive. But Leanne, the Pathways coordinator, said it's a really funny space because all of a sudden everybody's very silent and they are really confronted by what they're learning, the statistics around it, how this is happening, how sexual choking has become popular. So they and they're the ones often going, oh, have you spoken to the schools yet? You need to be in there, give us time. But they are driving a lot of the promotion around it, reaching out to their colleagues and going, I've just been to this. So what they're learning is symptoms, where the client can have the assessment, send them to us, what services are available, and just really promoting knowledge that people are very unaware about. And I feel if social workers in hospitals are confronted, that's a big thing. That's a really big thing because social workers in hospital see many things. And it's really, if they're alarmed, we should be twice as alarmed, shouldn't we, really? Yeah.
Absolutely. So just for any listeners out there who are interested, we are partnering, we are running this training free between us. Thank you to the generosity of the Shoalhaven Women's Centre for that. There are only a few spots left, but I do encourage everybody to consider coming along to that training.
And wherever we run this in community, it's free. So, we're not charging anybody. And I must say, Leanne brings a fantastic morning tea. So, I think when you're talking about content like this, I think you've got to have something to just relax you and put you in the space. But she provides all the PowerPoint with it. As I said, you have information that you can take away with you. And, of course, we are the resource as Shoalhaven Women's Health Centre that you can come to us or send your clients to us and we can look at the assessment. And the great thing about Leanne in when she does the assessment and of the situation and the symptoms, the client is with her. They do a one-on-one assessment, which is really good because it's private and it's confidential. She takes the notes of what she's doing. She's very efficient. You go and sit in the waiting room and have a cup of tea. 10 minutes later, she walks out with that assessment and you take that referral on the day. Because a lot of times, you've got to get a referral. We avoid it. We can't do it. When you're working with trauma, it's very hard to go, I'll come back next week. People, they're not in that space. Nothing to do with it. So the fact that you are walking out with that referral, we can contact where you want to go. We can do that for you. So we really are trying to make this streamlined and easy pathway because we know for anybody dealing with trauma, it's hard. It's hard. And, to be said, one more phone call. No, we don't do it. We don't do it. So,
it's amazing trailblazing work. How can listeners support what you're doing? We've talked a little bit about some of the advocacy that we need. We definitely need more funding. Government, we definitely need more funding.
Yes, please. That would be really lovely. We would love more funding to keep that project going at Women's Health New South Wales. But wouldn't it be, women's health centres, there's more than one of us throughout the state. We have many centres throughout the state. And wouldn't it be great to just have that worker funded in a position as health promotion? Because it is health promotion. We talk a lot about rugby and NRL and concussion and what's happening to their brains. But there's also part of it that they know these days, the risks of when they step into that space and sports are really taking it very seriously, taking people off, doing checks, saying to them you can't play for a number of weeks. They're really taking control about it. But it kind of ends there with the footballers and the sports as compared to people in their own home where they should be safe and engaging in safe practices. So again, it's promotion. It's again, talk to the young people in your life. We need to get out in community. We need to be where young people meet. We need to have information in campuses. I'd love to see the 1-800-RESPECT promotion that they did years ago, and it was really, there was a sticker on the back of every toilet door, wasn't it, wherever we went. And 1-800-RESPECT, we all know that now. It's like Lifeline. We all know it's out there. Wouldn't it be great, QR codes, everybody's doing that, finding information. If we could just make people curious. Oh, I tried that. Maybe I should read that. Sunscreen. Sunscreen years ago, we got burnt to death when we were little. But it's just really just change the dialogue, make people curious to see what they're engaging in. And if they do want to participate in sexual choking, limit what you're doing. Just be careful around it. Just learn the facts. And learn what you're consenting to, but equally learn the symptoms. And if something has happened to you, what do I do next? Where do I find the information? So we really need It Left No Marks to be like 1-800-RESPECT. It's just another part of our life and just the way we do it. But we do know that health campaigns are sometimes slow and they take a little while to get off the ground. But equally, when we talk about content like this, no, I don't want anything to do. I couldn't talk to my kids about it. We need to. We need to.
We absolutely need to because I think you've really spelled it out there. nobody should acquire a brain injury because they've consented to have sex with someone.
Correct.
And that is the risk. We're already talking about acquired brain injury in sports.
Mm-hmm.
We just have to start talking about acquired brain injury in sex.
And that's exactly right. And when you think about it, if you knew what you were participating in now might infect your employment for the next 30 or 40 years because you've done something that you thought was okay, yeah, it's not good. We're talking lifelong health issues, and it's just got to be educated. And people, young people, we're meeting in this fantastic space today. They need to have lots and lots and lots of stuff about sexual choking and non-fatal strangulation.
So, Tracy, this podcast called Community Matters, and we always ask all of our guests, who's somebody or some people in the community that matter to you?
Right, really interesting question, and community does matter. I must say the people that really matter to me and the people that I admire most in community, and I am at the Shoalhaven Women's Health Centre, is our women that walk in the door. They walk in, they're brave, they share their story with us, they are vulnerable, they trust us, and we try and lead them through a journey of recovery, financial. There's all that stuff that goes with it, financial, coercion, their mental health. I just, every day they come through the door and they trust us with their journey. So those women in community who are brave and they speak out and they want to change their lives, they're great. They're just because whilst I'm a worker, it's I don't know how brave I'd be, and they are, and they want to make a difference to themselves and their families and the community. So I think the women that walk through my door are the ones that I admire the most.
They are the heroes. Absolutely, absolutely. Thank you so much, Tracy. Before I wrap up today, is there anything that you wanted to say that you feel like you haven't had the opportunity to?
Look, I think a lot of this is something that is subject is going to grow and continue to grow. But what I would just like to say is sex isn't scary. We've all done it. Violence is scary. So we really need to stop that, and we really need to raise awareness of non-fatal strangulation, especially in the framework of domestic violence and what can happen to women. But young people, just start to educate yourself and take your young people in and care for them, whoever they are, and raise the subject of sex. It's going to be uncomfortable and we're going to look there, we've never liked to talk about it, but you know what? We all wouldn't be here if somebody hadn't done it. So, it really is a natural part of life, and somehow we've made it just so overwhelming. Look at what's going on in your home. Look at what your children are viewing. And if it's not right, or you see something that's not right, don't just go and run to the other room. Go, why are you watching that? Do you know about it? Let's have a chat.
That is great advice. Thank you, Tracy.
Thank you, Nicky.
Thank you to our listeners and viewers if you've made it through this. It's heavy content, but I think you've made this really difficult subject really accessible to people. We will put all of the links in our show notes, and once again, all of those numbers. If you feel that this has raised something for you, we'll put all of those numbers so that you can get support. Thank you so much, Tracy. The Shoalhaven Women's Health Centre doing amazing work, as do all of our beautiful women's health centres out there. Thank you all for joining Community Matters. Don't forget to tune in next time. Like us, leave us a review, share this important subject with other people. And don't forget to check out the amazing work of Tracy and Shoalhaven Women's Health Centres, and tune in again for the next episode of Community Matters.